Dr. Levine, you have supported both allowing minors to be given hormone blockers to prevent them from going through puberty, as well as surgical destruction of a minor's genitalia. Like surgical mutilation, hormonal interruption of puberty can permanently alter and prevent secondary sexual characteristics. The American College of Pediatricians reports that 80 to 95% of prepubertal children with gender dysphoria will experience resolution by late adolescence if not exposed to medical intervention and social affirmation. Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I would look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
The specific question was about minors. Let's be a little more specific since you evaded the question. Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? You have said that you're willing to accelerate the protocols for street kids. I'm alarmed that poor kids with no parents who are homeless and distraught, you would just go through this and allow that to happen to a minor. I would hope that you would have compassion for Kira Bell, who's a 23-year-old girl who was confused with her identity. At 14, she read on the internet about something about transsexual. She thought, well, maybe that's what I am. She ended up getting these puberty blockers, cross-sex hormones. She had her breasts amputated. But here's what ultimately she says now. And this is a very insightful decision from someone who made a mistake but was led to believe this was a good thing by the medical community. I made a brash decision as a teenager, as a lot of teenagers do, trying to find confidence and happiness, except now the rest of my life will be negatively affected, she said, adding that the medicalized gender transitioning was a very temporary, superficial fix for a very complex identity issue. What I'm alarmed at is that you're not willing to say absolutely minors shouldn't be making decisions to amputate their breast or to amputate their genitalia. For most of our history, we believe that minors don't have full rights and the parents need to be involved. So I'm alarmed that you won't say with certainty that minors should not have the ability to make the decision to take hormones that will affect them for the rest of their life. Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and talk with you and your staff about the standards of care and the complexity of this field.
Let it go into the record that the witness refused to answer the question.
I agree with you that biologically a man is a man and a woman is a woman. I was just wondering what you see the detriment of society, why we can't let a transgender woman be called she or something.
Because it is a lie.
I agree.
Detrimental to society. So I think there are a couple of reasons. So yeah, sorry, you let him finish the question. That's fine.
No, I'm just wondering, what do you see? I understand it's lying. I was taught not to lie. I just don't understand what is so wrong about that specific lie.
Well, I mean, as opposed to other lies, I'm not sure there is anything wrong. I mean, I don't like all of them. But as far as that specific lie, I think that one of the problems that we have is this determination that men can become women and women can become men undermines some barriers between men and women that I think are useful and good, particularly in children. So if I have to teach my 3.5-year-old, right, she's almost 4, if I teach my almost 4-year-old girl that she can become a boy, then I think that is not only lying to her, I think it's confusing her, and I think it's damaging to her psyche. One of the premises of the transgender movement is that human minds are completely non-malleable. That oddly enough, men are not men and women are not women, but if you are transgender, that is unchangeable, and that especially among children, if a 3 or 4-year-old has certain feelings, those feelings have to be taken completely seriously. We can't fight against them. We can't suggest that the kid will grow out of it. Instead, we have to say that this kid is inherently transgender. I can tell you, having kids are incredibly malleable. Kids are easily confused. And saying to a child, which is what the transgender movement would like to do, I mean, they're having drag shows in kindergarten now in some areas. When you do that, when you confuse kids about gender, you're doing the kids no favors. You're doing them or you could be doing significant damage to kids. Kids should not be confused about their biology. Kids should not be confused about their gender. And let's put it this way, just from a certain statistical standpoint, if it is true that the transgender suicide attempt rate is 40% over the lifetime, and if I am right, then more kids will be confused about gender, which, by the way, you do see. You've seen an uptick in transgender surgery in Europe. You've seen a greater identification as transgender overall. In places like Europe, malleable rates of transgenderism in Europe. If that's the case, then you're raising the suicide rates, presumably, if there's an association, between for young people who are now confused about gender. So I'm not in the mood for countenancing lies about what men and women are, specifically when I think that there is a goal of redefining a key term for the entire society.
Thank you.